Hello everyone, so this is just a quick tip Tuesday. I figure I'll have this Medicare tip Tuesday for you folks to actually utilize Medicare, and I'll reserve Monday for just kind of news. I got an email today from one of my clients who had a question about their Part D coverage. In fact, yesterday I had very similar conversation with one of my clients about Part D. Now Part D, for those of you on Medicare, that's where your drug program is going to be tied to. That's kind of like what I call pharmacy insurance. And in pharmacy insurance, or prescription drug plan insurance, the drug that you are prescribed that can be picked up from the pharmacy can be very expensive due to a whole slew of all kinds of pricing and background noise, background things that the drug companies who make the drugs and the drug insurance companies who pay for the drugs, that can be all messed up. So there's always a few things you can do to help you actually save money at the pharmacy. And there's going to require some background kind of research before getting to the pharmacy, but I wanted to go over what I do for you folks so that you can kind of get an idea of, perhaps if you can't reach me and you got to pick the drug right away, or if for whatever reason, I can't get back to you in time. This does take a little while, so I'll show you what it would take to kind of go ahead and look through how to find whether or not your medications would be better off picked up from the pharmacy with insurance, with a coupon card, or by cash, by itself. And the first way to do it is to first look at the insurance or the non-insurance way by going to these three sites. So I use GoodRx, Single Care, and National Drug Card. And with all of these, this is a completely free service. For GoodRx, let's go ahead and type in one of the drugs, esomeprazole, which is generic Nexium, which can be purchased over the counter. Okay, it does take a while to load up. And you can type in your location here if you need to change the location to find pharmacies closer to you, but I just have in 96706 for Eva Beach area. And you can see that, look at that, for omeprazole, it can be just $5 at Safeway versus $55 at Long's, and as you can see, it does get more expensive. So what we can see here is that if we didn't have insurance, we didn't use insurance, $5.28 is the best price. And we can go check here for that same medication. Generic Nexium, 40 milligrams, and $11.89 at Costco seems to be the lowest price. So it's going to be this one is the one that we're going to use. So, we'll check that National Drug Card, I'm going to say, is a little bit harder to use, but for certain niche medications, it'll be cheaper. So it's always good to check. We're going to have to find prices, and for National Drug Card, you will have to change the quantity because for some odd reason it defaults to 1, and most times you're not picking up just one tablet. So for a quantity of 30, we would have, look at that, $12.20. So it's going to be more expensive at with the National Drug Card, but as you can see, National Drug Card does have all these, like the hospital pharmacy. A lot of the more niche pharmacies are located in the National Drug Card versus in GoodRx and Single Care, which basically contract with the big box pharmacies like Long's, Safeway, Walmart, Costco, etc. So by just looking at those three sites, which took about 3 minutes, we find that Safeway is the best one. So Safeway with GoodRx, get free card, click there, and it will provide you with this thing which you can text to yourself, text to your phone, so that when you get to the pharmacy you can actually show it to them. Email it to yourself if that's easier, or print out a hard copy so you can take it with you to the pharmacy. Now the next medication, the one that I found National Drug Card to be a better price for, is something called Lotamax. Now, Lotamax is for those people who are getting cataract surgery. It is a type of drop that you can get that you have to get anyway for your before you get cataract surgery. And you can see $67 at Walmart. This one has higher cost at $70. But here it's only $20, right, at Long's. If we push it out to more pharmacies, price does go up. But at Long's Drug and CVS, this medication, the Lotamax, which is generic, is called Loprenol, right, for the same thing, 0.5%. It does cost far less at or with the National Drug Card. So it's always good to kind of, like I said, use these three. These are the major three that I use. Sometimes single care will have better prices. It's not just all the time that single care is the loser. Just happens to be for this medication, the esomeprazole, the generic Nexium, because drug plans. Let me just give you some quick background, kind of what I see when I look through the plans. Let me go here and show you this here. This is my dashboard to look through plans. We use the same zip code, 96706. We'll shop for plans in the Honolulu County area. If I were to put in a prescription drug of esomeprazole, and go to my plans, I have to add pharmacy, Walgreens, Long, Safeway. That seems to be the most used with most of my clients, you folks out there. And we go to the prescription drug plans. So remember, the cheapest we could get it for was $5.28 without using any insurance. So let's go ahead and check this one right here. Let's see how much it costs using this plan here. $11.71. Now that's with a PDP plan that has Walgreens in the preferred network. It still costs more than if we just went to Safeway. Now Safeway, if you use this insurance, it would actually cost you $23. Okay, let's go to another insurance plan, because esomeprazole may not be covered in certain plans. Well, it looks like it is for the most part in all these plans here. There we go. So if you were to, for some reason, Savers Plus, if you were in this AARP plan, or even this one right here, the one right above, and you don't have coverage for this drug now costs $248 for the same drug if you picked it up with this particular PDP plan. Same company, different plan. No coverage equals huge costs, when you can just go here, type in esomeprazole, and get it for $5.28 for the same exact prescription. 40 milligrams, 30 capsules. 40 milligrams, 30 capsules. Huge difference. So that's typically how I will kind of shop around. when I do your initial drug search, which, I mean, some people have 10 or more drugs, so it can get kind of time consuming. But if you folks wanted to kind of do it throughout the year, because drug plans change throughout the year, I'll link some videos in the email and also in this video description that kind of talk about how the drug plan can change every month, drug costs can change every month, and how it really puts all the members of every single healthcare plan out there at the mercy of both the drug companies and the insurance plans. And we can't really do anything about it because we can't change plans, even for those of us who are still working or part of the Affordable Care Act network or Affordable Care Act structure. We're all stuck in a plan for a calendar year usually, or whenever our next open enrollment is. So we can't really make these changes, although the insurance companies and the drug companies can. And due to that fact, we're going to have to be able to kind of maneuver with every available resource. And one of the available resources is the discount cards that are available. Now, for those of you folks who may be on really expensive, let's call it injectables, or just really expensive things, brand items that have no alternatives. For example, Stelara. It's very, very expensive. Specialty medication used to be part of Part B. So for those of you who have a Medicare supplement plan, if you were prescribed this medication after your deductible, for those of you on a plan G, you would pay nothing for this medication. For those of you who are on a plan N, you may have to pay the $20 copay to see your physician to get him or her to inject this. As you can see, even with this coupon, it's still $25,000 for one shot. It's not the only one. No, not Farxiga. We'll go with this one because most people know what this one is. Prolia. Prolia is for osteoporosis. And here it is. Even with the coupon, this drug is $1,300. And as you folks know, if you folks are on this, usually you take two of them per year. And again, used to be covered or can still be covered under Part B. And so what you would need to do is you actually need to go, oops, we don't need that. You would need to go to the Patient Assistance Program. And through a lot of navigation, I can't remember which foundation was it, if it was the Johnson & Johnson Foundation or if it was the CarePath, because only one of them helps you if you're on Medicare and the other one helps you if you are not on Medicare. Well, needless to say, for this particular medication, because I've helped a client with this in the past, I actually have their patient assistance program. So let's go pop it out here. So this is the patient assistance program for Stelara. I guess it's with the Johnson & Johnson Patient Assistance Group or Foundation. As you can see, Stelara is all the way down here. So that is how you would get this medication covered and not pay $25,000 a shot. Your healthcare provider would have to provide the information here, healthcare professional. Either your nurse practitioner or your physician would have to fill this out. Tell why you are taking it, how much you take, sign, and fax. All the information is located here. You would need to qualify financially though, so it's not like you have to be making like less than the federal poverty level. Usually for the patient assistance program, as long as you're making about $80,000 to $90,000 a year or less, you would qualify. They use a formula of if the drug costs more than something like 15% of your income, then the drug should be provided to you at no cost, and that's kind of what they do. There's also one more solution. If you were unable to fill out these forms yourself, there is a program I just recently found called NiceRx. So NiceRx, what they do is they help you with FDA approved brand medications, and they charge you $50 a month. It's kind of like how they pay for what they do, and I assume they will go ahead and help you with your enrollment application and make sure that you qualify financially for the medication so that you can get these like Stelara at no cost, and you would just be billed $49 for your participation in their service. So I have not used it. I've been approached by these people to give you guys a kind of introduction to it. Again, I don't know if anyone has used it. I personally have not used it, but it would be a really good source for you folks who need help getting those really expensive medications, especially if you can't do it by filling out the form yourself, that patient assistance program yourself. Yeah, if you can't fill out this one, if you can't fill out this form by yourself, then perhaps getting some help from NiceRx would be a option. Well, I hope that helps. Part D of Medicare is one of the most confusing and irking things that I have to deal with. It's also kind of like how I am able to identify or stand out in the crowd, because I do so much work in that space. Now, that doesn't mean that I want everyone else to do a lot of this work in this space, but I just want you to know that there is a lot of kind of background things that go on, and there isn't a set in stone way when you sign up for a plan that it's the one for you forever, especially during annual election period, which is coming up in the next 4 months. It'll be October again. This is in June. I'm recording this video. So please reach out to me with your new medications, in October, so that we can review them. Give me some time to go through all the things that I have to go through to make sure that your medications are the best way to get them covered, and give me some time to research. It took me about an hour or two to find that this was the right one. I called them, I asked them questions if this is the right one for my my client who is going to transition to Medicare. Would they be able to fill this out? What's the timeline like? And like I said, these things too, the patient assistance programs, can also change every year. So, and the qualifications, of course, as well, can change every year. So with that said, just know that it is a lot of time-consuming and kind of navigating work to do. So don't do it all yourself. Let me help you where I can, but I just wanted to give you guys kind of a lowdown. So if you wanted to kind of check from time to time whether or not you should be using insurance, GoodRx, or if there's a patient assistance program available, there's all the information. That's everything that I use in my head currently to navigate the Part D Medicare drug programs. Hope that helps. You guys have a great rest of the week. Remember, for more tips like this about Medicare, let me know that you want this kind of videos, because if not, I won't post them out. But I just had this case that just came through this morning, and I wanted to share it with all of you. Have a great rest of the day. Bye-bye now.